But there are not much cancer when it comes to supportive care, when it comes to survivorship, and also in assessing needs among cancer survivors, not just for colorectal cancer, but actually for other cancer as well. Okay, so why assessing needs is important? So as mentioned earlier on, from the current body of literature, the unmet needs among colorectal cancer survivors are still scarce. So when searching the literature, we can only find research from high-income country, which might or might not be replicable in our country. So as mentioned by the presenter, I think Dr. Yoga, right, from Monash. So he mentioned that the study in Western country is more or less similar with local country. But I beg to differ because we have different settings, health settings, we have different culture, we have different lineages. So we have to know and understand more about our own population instead of relying on study from outside. Now, other than that, we found that there is a significant research gap when it comes to the unmet needs and what are the determinants of these unmet needs. And why we want to understand needs is for us to improve the survivorship care plan in Malaysia. Okay, next. So this is just infographic from the study that I conducted together with CORUM and also University Malaya. I forgot to mention my supervisor is Prof. Nirmala, one of the panelists earlier on. Okay. So from the questionnaire that was developed, it was named as NEED-CC, which is a needs assessment tools for colorectal cancer. It had 48 items with 6 domains. And it had undergone statistical analysis to look for the validity and reliability of the questionnaire. And it was then distributed among 630 respondents, colorectal cancer survivors. Okay, next. So this is basically the distribution of needs among colorectal cancer survivors. So you can see that across all of the domain that was studied, there is high to very high needs when it comes to diagnosis needs, psychosocial information, as well as healthcare needs. But there is also considerably high, moderate to high needs when it comes to financial and employment. These are two domains that usually left out, or people just like don't care. Okay, so move on. Okay, so when we further do analysis, statistical analysis to look at what are the factors associated with all these high needs, so we found that those younger age group, those with presence of stoma, those without private health insurance, and those going to government hospital actually have higher needs compared to those attending academic hospitals. Okay, so I cannot elaborate more on that. So all the high level of needs actually is very important and alarming. So it indicated that we have to do something for our patient, for our survivor. And when you look at the financial and employment needs, it's also very alarming because we do not have any employment protection policy in Malaysia. Are we aware of that? Okay, so this is something that we should advocate. So I believe that you guys have some interest in research because you're staying in this room. So hopefully if you do research, please do also include this employment and financial issues, and we should advocate for this policy to be implemented, at least some protection policy for our cancer patients. Okay, so next. So basically, just to highlight again, these are the research gaps that we identified that if you plan to do research, you can focus on this part. Okay, next. Okay, some strategies. Just a little bit in terms of the strategy, what we do was we collaborate with a lot the NGOs. That is also why I ended up in volunteering, but actually it's a happy thing to do. Okay, and we collaborated with private hospital, with government hospital, academic hospitals, and I remember hearing the term co-create just now, right? So actually co-create and co-design is used interchangeably. So the meaning is the same, where they want patient to be in the study. They want the patient's voice to be heard. So it's important for you to also advocate for the patient to join the study. Okay? Okay. So just to tell a little bit of suara kita, part of the collaboration, CORUM have been working together with BCWA, with other organizations. So from that networking, we developed a coalition called Suara Kita. I believe that and CSM is not part of Suara Kita, but they support us because we also did our workshop in NCSM. I think last year. Yeah. So basically, what Suara Kita is doing, they are combining different organizations, not just about cancer. And from here, we are recognized by MAHTAS. If you ever heard of MAHTAS, MAHTAS is a Malaysia Health Technology Assessment where they do things related to clinical guidelines, and they have this technical working group. So the gap that we identified was that they don't know who to approach when they want to come up with this guideline. Which patient should they go to? So they are happy to know Suara Kita, and we are also happy to be part of the technical working group. Okay, I think that's my last slide. Okay, that's all from me. So thank you very much for your attention.